Hello, 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 everybody. Welcome, welcome, welcome. Tonight, we are going to discuss what's better, dialysis or kidney transplant. I've noticed that in some of my Facebook groups recently, folks seem to be reluctant to undergo the process of obtaining a kidney transplant and would rather remain on dialysis. This evening, I'd like to discuss the issue from a scientific perspective, but including the personal experience of some kidney patients. Here's the way that I've organized this discussion. First, what is dialysis? Then next, what is kidney transplant? Which is preferred, dialysis or kidney transplant? Who pays for a kidney transplant? How are the immunosuppressant medications paid for after a kidney transplant? What are the advantages and disadvantages of dialysis? Choosing between dialysis and transplant. What comes first, dialysis or a kidney transplant? Is survival better with dialysis or transplant? What is the life expectancy of a person on dialysis? What is the life expectancy of a person with a kidney transplant? How long does a transplant last? Which is more cost effective, dialysis or kidney transplant? How long can a person live with just one kidney? Who is not a good candidate for dialysis? And finally, our conclusions. So, welcome to the broadcast this evening. And let me get my notes up here. Make sure we got our banners going. Okay. First of all, what is dialysis? Dialysis is a treatment that cleans your blood when your kidneys can't do it properly. It removes waste and excess fluid from your blood, helping to keep you healthy when your kidneys are failing. There are two main types, hemodialysis and peritoneal dialysis. When your kidneys fail, they can't filter waste, excess water, and salts from your blood. This can lead to a buildup of toxins and fluids, causing various health problems. Dialysis acts as an artificial kidney, replacing the function of the kidneys and filtering your blood. As I said, there are two main types of dialysis. Hemodialysis, this type uses a machine, also called an artificial kidney, to filter your blood outside your body. You go to a dialysis center several times a week for treatments. For me, it was 3 times a week, 4 hours of treatment. Peritoneal dialysis, this type of dialysis uses the lining of your abdomen, your peritoneum, to filter your blood. You can do this treatment at home by infusing a special fluid into your abdomen. So, how does dialysis work? Hemodialysis, the blood is drawn from your body, passed through a dialysis machine and a dialyzer, and returned to your body without the bad stuff. Peritoneal dialysis, a dialysate fluid is put into your abdomen where it drains out the waste and excess fluid. The fluid is then drained from the abdomen, removing the waste. What are the benefits of dialysis? Removes waste and excess fluid, helps regulate blood pressure, maintains healthy levels of minerals and vitamins, and it can help produce red blood cells. So, what is a kidney transplant? A kidney transplant is a surgical procedure where a healthy kidney from a donor is implanted into a recipient whose kidneys have failed. This allows the transplanted kidney to take over the function of the recipient's failed kidneys, helping to filter waste products and excess fluid from the blood. Why is it needed? Kidney failure, also known as end-stage renal disease, can lead to a buildup of toxins and fluids in the body, requiring treatments like dialysis to maintain life. A kidney transplant offers a more permanent solution, potentially improving the recipient's quality of life and overall health. Donors. Kidneys can be donated from a living donor, i.e., relative, friend, even a stranger, or a deceased donor individuals who recently died and been declared brain dead. The procedure: during the surgery, the new kidney is placed in the lower abdomen, and its blood vessels and ureter are connected to the recipient's blood vessels and bladder. After transplant, the recipient will need to take immunosuppressant medications for the rest of their life to prevent the body from rejecting the new kidney. Regular follow-up appointments with a transplant team are necessary to monitor the kidney's function and address any potential complications. Living with a transplanted kidney: with proper care and management, kidney transplant recipients can live relatively normal lives with reduced dependence on dialysis and overall improved health. Success rates: kidney transplants are highly successful with good long-term outcomes and reduced rates of complications compared to dialysis. Preemptive kidney transplant: a transplant performed before the need for dialysis begins. The benefits are that a preemptive transplant, they have been shown to lead to a better long-term health outcome, including an improved quality of life and a greater likelihood of success. So, which is preferred, dialysis or kidney transplant? And we're talking here from a scientific level. Kidney transplant is generally the preferred treatment for kidney failure, offering a better quality of life, increased life expectancy, and fewer dietary restrictions compared to dialysis. However, dialysis is a necessary alternative for patients that are awaiting transplant or who are not suitable candidates for transplantation. What are the advantages of a kidney transplant over dialysis? First, an improved quality of life. Transplants can eliminate the need for dialysis, allowing patients to enjoy more freedom in their daily routines, and they have more energy. You get an increased life expectancy. Studies show that patients with successful transplants often live longer than those on dialysis. There are, of course, fewer dietary restrictions. Transplants allow for a more normal diet with fewer limitations on fluid intake and food choices. What are the disadvantages of a kidney transplant? The waiting list. Finding a suitable donor can take time, and some individuals may never receive a transplant. The average wait time for a kidney transplant in the United States is somewhere between 3 and 5 years, though it can vary significantly. In some states, some individuals may wait potentially up to 10 years, while others may experience shorter wait times. Factors that influence wait times: the availability of organs. The number of available deceased donor kidneys is limited, so wait times are influenced by how many donors are available in a given area. Blood type compatibility. Some blood types, like O, your Uncle Jim is an O type, may have to wait longer times. Your medical condition, the severity of your illness, and how well you match with potential donors can impact wait times. Location. Transplant centers in some regions have shorter wait times than others. For example, a wait time in my home state, Indiana, for a kidney transplant is like the U.S. average, somewhere between 3 and 5 years. Now, your Uncle Jim, I waited 4 years, for example. However, this time can vary significantly based on factors like blood type, geographic location, and the number of people on a waiting list. For example, the wait time for a kidney transplant in New York is generally 5 to 7 years for a deceased donor kidney. New York has a significant number of individuals on the transplant waiting list, with about 7,000 people waiting for a kidney transplant. Multiple listing, being on multiple transplant centers' waiting lists, can potentially increase your chances of getting a transplant faster. For example, the kidney transplant wait time in California ranges from 2 to 10 years, depending on factors like blood type and donor availability. According to the data from a 2019 study, Alabama has the longest wait time for organ transplants in the United States. In Alabama, 30.6% of the patients on the transplant wait list have been waiting for over 5 years. Other states with relatively long wait times include Hawaii, California, and New York. However, it is important to note times can vary significantly based on factors like blood type, geographic location, and the availability of living donors. For a living transplant, if you can find a living donor, you may have a much shorter wait time, often within a year or less. Waitlist information. To get on the wait list, you need to contact a transplant center and you'll have to undergo a full health evaluation. Once evaluated, your name is added to a national transplant list managed by the Organ Procurement and Transplant Network, or the OPTN. The National Kidney Foundation estimates that there are currently about 93,000 people on the kidney transplant wait list. Types of transplants. Obviously, as we've discussed, there's a living donor transplant, a transplant from a living healthy donor, which often results in quicker transplantation and better outcomes, or a deceased donor, a transplant from a deceased donor, which may have a longer wait time. Surgical risks. Like any surgery, kidney transplantation carries risks of complications, including infection, bleeding, and, of course, organ rejection. Medication requirements. Transplant recipients will need to take immunosuppressant drugs for life to prevent organ rejection. Issues with immunosuppressant medication. And this is why I'm seeing more people in my groups recently that seem to be reluctant to leave dialysis to get a transplant. Immunosuppressant medications, while vital for preventing organ rejection and managing autoimmune diseases, carry various potential side effects and risks. These range from increased susceptibility to infections to long-term health complications like diabetes, high blood pressure, and certain cancers. Common side effects would include a risk of infection. Immunosuppressants weaken the immune system, making individuals more vulnerable to infection from common illnesses like cold to more serious fungal or viral infections. Stomach issues. Nausea, vomiting, diarrhea, and upset stomach are common side effects which require adjustments to the medication regimen or switching to a different immunosuppression. Skin changes. The AAKP has talked about this recently. Immunosuppressants can cause hair loss, growth, acne, as well as bruising, affect wound healing, and itching. If you have that itching problem, it's probably due to those medications. Metabolic changes. Some immunosuppressants can lead to weight gain, increased appetite, high blood pressure, high blood sugar, or hypoglycemia. Neurological issues, which include headaches, tremors. Have you had that experience where you take your tacrolimus and your hands shake a little bit? Sleep disturbances can often occur. Insomnia and kidney patients go together, as you know. Other side effects, fatigue, mouth sores, bone thinning, osteoporosis, and also other potential side effects. There is an increased risk of cancer. Long-term use of immunosuppressants can increase certain types of cancer, including skin cancer. Long-term toxicity. Continued use of immunosuppressants can lead to long-term complications like gastritis, peptic ulcers, diabetes, and high cholesterol. So how do you manage these side effects? First, through monitoring and adjustments. Close monitoring by your healthcare team is essential for managing side effects and adjusting medication regimens. Lifestyle modifications. Healthy lifestyle choices include a balanced diet, regular exercise, and stress management that can help with some side effects. Medication changes. In some cases, switching to a different immunosuppressant or modifying the dosage can help reduce the side effects. Supportive therapies, nutrition, counseling, physical therapy, and other supportive therapies can help manage side effects and improve your quality of life. Other important considerations with kidney transplants. Pregnancy. Some immunosuppressants can cause birth defects, so it's critical to discuss the risks with a doctor before becoming pregnant. Other health conditions, individuals with certain health conditions like a compromised immune system should not take immunosuppressants. Interactions, immunosuppressants can interact with other medications, so it's essential to inform your doctor about all the medications that you're taking. So to sum up, why immunosuppressants are essential for managing various medical conditions, it's also important to be aware of the potential side effects and risk. Close monitoring, lifestyle modifications, and in some cases, medication adjustments can help manage these side effects and improve the overall health and well-being of individuals on immunosuppressant therapy. So, which is better, dialysis or kidney transplant? Here's what the experts say. A transplant offers a more active lifestyle without needing dialysis. A kidney transplant requires ongoing care. You will need to take medications to stop your body from rejecting the kidney, your anti-rejection medications, for as long as you have the transplanted kidney. So, who pays for a kidney transplant? A kidney transplant is typically paid through private insurance, Medicare, or a combination of both, with potential assistance from Medicaid or other plans that cover the cost of transplant and follow-up care, while Medicare covers certain services and medications. Medicaid can serve as a primary or secondary insurance, and there are also financial assistance programs available. Private insurance. Private health insurance plans typically cover the cost of the transplant procedure, including hospital stays and doctor services. Many plans also cover the cost of immunosuppressant drugs, which are critical for preventing rejection of the new kidney. Deductibles, copays, and coinsurance may still apply depending on your specific insurance plan. Medicare Part A covers the full cost of donor's care in a Medicare certified hospital. Medicare Part B covers various services, including transplant services, blood, doctor services, and immunosuppressant drugs in certain circumstances. Medicare may also cover the cost of some follow-up care after transplant. Medicaid can be a primary or secondary insurance option for transplant recipients. It can help cover costs not covered by other insurance plans or to supplement coverage. Other financial assistance, the National Living Donor Assistance Center, the NLDAC. This program is administered by the U.S. Department of Health and Human Services and can help with lost wages, travel expenses, and child care costs associated with kidney donation. The Donor Shield, this program offered through the National Kidney Registry, covers costs for meals, travels, and lost wages for donors involved in certain transplant centers or swaps. Transplant-specific assistance. Some transplant centers offer financial assistance program to help with costs not covered by insurance. This occurs through nonprofit organizations. Various nonprofits provide financial assistance to transplant recipients. Government programs, depending on the recipient's income and circumstances, other government programs may also offer financial assistance. How are immunosuppressant medications paid for after transplant? Through the Comprehensive Immunosuppressant Drug Coverage Transplant Patient Act of 2020, also known as the Immuno Bill, the bill extends Medicare coverage for immunosuppressant transplant drugs to kidney transplant patients indefinitely, according to the National Kidney Foundation. The bill was a result of 20 years of advocacy by the transplant community and was designed to improve transplant outcomes and reduce dialysis costs. The key aspects of that bill. First, the indefinite coverage. The bill extends Medicare coverage of immunosuppressant drugs for kidney transplant recipients beyond the current 36-month limit and Remember, there used to be an age requirement too. If you were an old guy like me, 65, you were good. If you were younger than that, then you only had that 36-month limit. That's not the case anymore. The focus on kidney transplant. The Immuno bill specifically targets kidney transplant patients and doesn't apply to other organ transplants. Cost reduction. The bill is expected to save money by reducing dialysis costs, such as kidney transplant recipients are more likely to be free from dialysis when they receive adequate immunosuppressant drug coverage. Cost effectiveness. Studies have shown that lifetime immunosuppressant coverage is cost effective, especially in reducing the risk of transplant failure. Advocacy. The bill is recognized as a result of 20 years of advocacy by various organizations within the transplant community, including the American Society of Transplantation and the National Kidney Foundation. The bill's official designation is H.R. 5534. That's H.R. 5534. The bill represents a significant step forward in ensuring that kidney transplant recipients have the same access to the necessary medication for a longer period of time, improving their quality of life and potentially saving money on dialysis costs. So what are the advantages and disadvantages of dialysis? Let's talk about the advantages first. Dialysis is life-saving. It can significantly extend your life for individuals with kidney failure when kidney transplantation is not an option. It gives you an improved quality of life. Dialysis can alleviate symptoms and improve overall well-being by removing waste products and excess fluid from your blood. It's less invasive than transplant. Dialysis is generally considered to be less invasive than a kidney transplant. There's widespread availability. Dialysis centers are readily available in most regions, making it accessible for many patients. It can be done at home, peritoneal dialysis. This can be done at home, offering patients more flexibility and independence. More dietary flexibility. Peritoneal dialysis may allow for fewer dietary restrictions. What are the disadvantages to dialysis? First of all, it's time consuming. Dialysis treatments require regular visits to a clinic and may require daily home treatments, including daily schedules and routines. There are potential side effects that include fatigue, muscle cramps, that itching that we talked about earlier, low blood pressure, and electrolyte imbalances. Emotional and physical strain. The need for regular treatments and dietary restrictions can be physically and emotionally draining. Peritoneal dialysis risks. Peritoneal dialysis risks include things like peritonitis or infection, the potential for peritonitis to cause the peritoneal to thicken and scar over time, and then you'd have to go back to regular dialysis. Home dialysis equipment. This requires dedicated space for equipment and may necessitate special plumbing and electricity. Dietary restrictions. Dialysis, particularly hemodialysis, often involves dietary restrictions to manage electrolytes and fluid levels. Very limited flexibility. Hemodialysis requires regular scheduled treatments, which can restrict spontaneity and travel plans. Usually that's done in an in-center dialysis treatment center. They have specific times, you have specific chair times that you have, and you do it with a group of people. So infection problems might happen. Cost. Dialysis can be expensive, but Medicare in the U.S. provides coverage for most people with kidney failure. So choosing between dialysis and transplant, making the decision, and this is very important, the decision between dialysis and transplant is a personal decision. It is essential to discuss the risks and the benefits of each option with your healthcare provider. So again, it's a personal, individual decision based on your health and talking to your doctor. Factors to consider would include your overall health, a patient's overall health, and the presence of other medical conditions can impact their suitability for transplant. Your age, some individuals may be too old or have other health conditions that make them ineligible for transplant. Patient preference, that always has to be taken into account. Patients should consider their personal preferences and values when making a decision. The potential for transplant, patients who are eligible for transplant should ideally start the process before they need to go on dialysis, as this may improve the chances of a successful transplant and its longevity. Usually, the goal is to find the treatment option that best meets the individual's needs and goals for a healthy and fulfilling life. So what is it? A 20% kidney function? They usually start talking about dialysis. So sometime before that, if you consider transplant, you should begin to start that process. So which comes first, dialysis or kidney transplant? Today, most people get a kidney transplant after being on dialysis for some amount of time. But that is not, and I want to emphasize this, that is not the only option. However, now a preemptive kidney transplant is available. A preemptive kidney transplant is a kidney transplant that takes place before dialysis. Preemptive transplant considerations. If a patient's kidney disease is progressing toward failure, discussing the possibility of preemptive transplant is a good idea. Now, this is key because most doctors don't discuss this as an option. This may be an issue that you yourself need to raise with your doctor as opposed to waiting for the doctor to suggest it. Before your kidney function dips below 20% is the best time. Is survival better with dialysis or a transplant? For many patients with end-stage renal disease, kidney transplant offers a better survival rate and an improved quality of life compared to long-term dialysis. Studies consistently show that transplant recipients experience a higher survival rate and live longer than those on dialysis. So let's look into this a little bit. Kidney transplants. Successful kidney transplants not only improve survival, but also enhance the quality of life for most patients. Dialysis. While dialysis can provide life-sustaining treatment, it can be also associated with significant health complications and a higher risk of mortality compared to the transplant, according to the New England Journal of Medicine. And at this point, I want to remind everybody, all of my notes, all the research, all of the citations that go with the things that we're discussing now are pinned to the top of my Facebook page, Jim Myers, Myers. If you go to the comments, all of that information is there. So if you want to look things up or you want to check out the citations, that's where you find them. What are the survival rates? Studies have shown that transplant recipients have a significantly higher survival rate than dialysis patients, especially when considering long-term outcomes. For example, a study published in JAMA, and again, the link to the study is in the comments to the broadcast. Researchers found that kidney transplants were associated with a greater survival benefit, particularly among older patients who have been on the wait list for over 2 years. Living versus deceased donor transplant. While both living and deceased donor transplants improve survival, the best are living donor transplants. They are often associated with an even better outcome, as they typically are associated with a longer graft life and lower risk of immediate complications. Your quality of life. Transplant recipients also often experience improvements in their quality of life due to the restoration of kidney function, leading to reduced fatigue, improved energy levels, and better overall health. For example, a 30-year-old on dialysis would have a life expectancy of about 15 years. With a deceased donor transplant, a kidney from someone who has passed away and is brain dead, life expectancy improves to 30 more years. Best of all, living donor kidney transplant increases your life expectancy to 40 years. So, what is the life expectancy for a person on dialysis? The average life expectancy for someone on dialysis is between 5 and 10 years. However, remember, we're talking about an average. This is not something that's written in stone. However, many individuals live well on dialysis for 20 or even 30 years. Life expectancy on dialysis can vary depending on several factors, including your other medical conditions, adherence to your treatment plan, and individual health status. So, what are the factors that affect your life expectancy? Existing medical conditions, chronic diseases like disease, diabetes, other health problems can shorten your life expectancy on dialysis. Adhering to a treatment plan, following the prescribed dialysis schedule, diet, and medication regimen is mission critical for maintaining health and extending your life expectancy. Individual health status, overall health, including age and other health conditions, can play a significant role in determining life expectancy on dialysis. The type of dialysis, home hemodialysis or peritoneal dialysis, can offer more flexibility and potentially lead to better long-term health outcomes. Survival rates and longevity. The average survival rate or average mortality rate for those on hemodialysis can be high, with some studies showing a 5-year survival rate of less than 50%. Improved survival rates. Over the past decades, survival rates for people on dialysis have improved, and this is a trend that is expected to continue. So, what is the life expectancy for a kidney transplant patient? A kidney transplant significantly improves life expectancy for individuals with end-stage kidney disease compared to dialysis. On average, a kidney transplant can add 10 to 20 years to a person's life. Let's take a more detailed look at this. Deceased donor transplants. The Mayo Clinic reports that the average functional lifespan of a kidney from a deceased donor transplant is around 11 to 13 years. Living donor transplant. That same Mayo Clinic notes that the average lifespan of a kidney living from a living donor is about 18 to 19 years. General trends. Overall, kidney transplant significantly increases the chance for living for many years after the procedure, especially compared to dialysis. News Medical states that a 30-year-old patient on dialysis might have a life expectancy of 15 years, while someone with a deceased donor transplant, that increases to 30 years, and a living donor transplant can reach 40 years. Factors influencing life expectancy. These factors would include the quality of the donor kidney, the recipient's overall health, adherence to medication, and other medical conditions that can influence the lifespan of a transplanted kidney. So, how long does a kidney transplant last? On average, a kidney transplant can last from 10 to 25 years. However, again, this is just an average. The lifespan of a transplanted kidney varies from person to person. Some people can live for many years after receiving a transplant, and others may experience the need for a second transplant. Let's take a more detailed look. The average lifespan from a living kidney donor typically lasts 15 to 20 years, while a kidney from a deceased donor lasts 8 to 10 years, according to the National Kidney Foundation. What factors influence the lifespan? Several factors can influence how long a transplant lasts, including the patient's overall health, the quality of the donor kidney, and adherence to post-transplant medications and lifestyle recommendations. Second transplants. Some people may require a second or even a third transplanted kidney due to complications or kidney failure. What disqualifies you from getting a transplant? Several factors can disqualify someone from receiving a kidney transplant. These factors include severe medical conditions, behavioral issues, and certain life circumstances. They include active or recent cancer, severe heart disease, uncontrolled mental issues, substance abuse, or a history of noncompliance with treatment. So let's take a look at some specific medical conditions. An active or recent cancer, current or recent cancer diagnosis can significantly increase the risks associated with transplant surgery and the long-term success of the transplant. Severe heart disease, severe heart conditions can make a transplant too risky as the body may not be able to handle the additional stress of the surgery and the immunosuppressant medications needed afterwards. Severe infections, an active or persistent infection that cannot be effectively treated, can complicate the transplant process and increase the risk of transplant complications. Severe multiple organ failure. If multiple organs are failing, a kidney transplant may not be the best treatment option, especially if other organ failures are not manageable. Behavioral and lifestyle factors, substance abuse. Active drug or alcohol abuse can make it difficult for a transplant team to ensure the patient will take immunosuppressant medications properly, potentially leading to organ rejection. Uncontrolled mental illness, severe or uncontrolled mental health conditions can impact a patient's ability to follow a post-transplant care plan. Noncompliance, a history of not following medical advice, taking medications as prescribed, or attending follow-up appointments can lead to a transplant being unstable. Other factors include morbid obesity. Severe obesity can increase the risks associated with surgery and can impact the success of a transplant. Advanced age, some transplant programs have age restrictions, and advanced age can make the transplant more risky. Short life expectancy, if a patient's life expectancy is very short, a transplant may not be the best course of treatment. Other important considerations, and these are critical. Each transplant center has its own criteria for accepting patients, and not all centers may have the same guidelines. Dental guidelines are an example. Some don't, some do. If you don't qualify at one transplant center, it doesn't mean that you will not qualify at another. A transplant team will conduct a very thorough evaluation to assess a patient's overall health, including physical and mental health, as well as their ability to follow the post-transplant care plan. If a patient is not deemed a suitable candidate at one center, they can still be evaluated at another center. Some individuals may be encouraged to make lifestyle changes, such as losing weight, stopping smoking, to improve their candidacy for a transplant. So in other words, you could be put on hold for a while, but if you follow their advice and you make the changes, that may move you up as a candidate for transplant and get you transplanted sooner. So, which is the more cost-effective, dialysis or kidney transplant? The experts say kidney transplantation is generally the more cost-effective over dialysis, even though initial costs are higher. While dialysis requires ongoing maintenance, including frequent hospital visits and medication, transplantation offers the potential for long-term savings to reduce need for dialysis and related treatment. Your initial costs. Kidney transplantation involves significant upfront costs, including surgery, pre-transplant care, and post-transplant medications. There's also post-transplant follow-up. Don't let them leave that out. Long-term costs. While dialysis is a critical treatment requiring ongoing care and medication, transplantation can offer long-term savings. Patients may require fewer hospitalizations and medication costs after a successful transplant and may be able to live more actively without the need for dialysis treatment. Cost effectiveness. Studies have shown that kidney transplants can be cost effective compared to dialysis, particularly in the long run, with the break even point between two treatments becoming shorter over time. Living donor transplants. Living donor transplants are often more cost effective than deceased donor transplants as they lead to better outcomes and reduced need for long term treatment. So, normally, when you get transplanted, unless you're getting a transplant from a child and you're getting two kidneys at the same time, you only get one adult kidney. So the question becomes, how long can you live with just one kidney? A person can typically live a long and healthy life with one kidney. A single healthy kidney can function just as well as two. While there's a slightly increased risk of developing kidney disease or pregnancy complications, these are generally manageable. So let's take a look at a little bit more detail. Normal function. The remaining kidney often compensates for the loss of the other, and many individuals with one kidney live a normal lifespan without significant problems. So this just says a little something about donation too, that someone could donate and basically that's not going to have much of an effect on the kidney that's left. Increased risk. Individuals with one kidney may have a slightly higher chance of developing high blood pressure or pregnancy complications, but these can be managed with proper medical care. Kidney disease. There's a small risk of developing kidney disease in the remaining kidney, but this is extremely rare. The importance of a healthy lifestyle. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing blood pressure, is critical for the signal kidney. Who is not a good candidate for dialysis? As we're going to see, they're going to make different recommendations for some people that are elderly. And this is something that I've been seeing recently in studies that I've been sharing to my group. So I thought it was important to discuss this. Dialysis can help with symptoms caused by kidney failure, but if you have other medical conditions, a stroke, Parkinson's disease, peripheral vascular disease, frailty, dementia, dialysis won't help with these symptoms. They cause and could make them even worse. Individuals with advanced fragility, significant comorbidities, poor functional status, or those who have expressed a preference for palliative care may not be suitable candidates for dialysis. Dialysis may not be the best option for those with severe, untreatable illnesses like advanced cancer or dementia, or those with other medical conditions that make dialysis a burden on their quality of life. Factors that can make dialysis less effective or beneficial. Advanced age. While age isn't a strict contraindication, older patients with multiple health issues may experience less benefit from dialysis. Significant comorbidities. Other serious health problems can make dialysis less effective or make them even worse. Dementia and other severe neurological disorders. Dialysis may not improve the quality of life for patients with dementia or other neurological conditions. Untreatable progressive diseases. Dialysis may not be the best option for those with progressive and untreatable illnesses like advanced cancer or diabetes. If you have a limited life expectancy, dialysis may not be the best option, and other palliative care options may be more appropriate. Poor functional status. If a patient is frail or has a limited ability to perform basic activities of daily living, dialysis may be more challenging and less beneficial. Personal preferences. Individuals may choose not to start dialysis if they believe it will not improve the quality of their life or if they prefer to spend their remaining time in a way that is more meaningful to them. Dialysis and the elderly patient. Among patients aged 75 and older, 5-year survival rates were around 57 to 58%, only slightly higher than a 54% seen in patients who remained on dialysis. This was particularly for those with cardiovascular disease or those receiving from kidney donors after circulatory death. The director of the ERA registry, Dr. Vyanda Stel, S-T-E-L, added, quote, the breadth of data we could access via the ERA registry showed that survival advantage of a transplanted patient plateaus for the very oldest or highest risk patient who are likely to receive an expanded criteria or circulatory death donor kidney. This arms clinicians with guidance to have informed discussions with their patients. The message is don't transplant older people. It's be open about uncertainty when the numbers say benefit may be marginal. So that's when you have those issues. So in conclusion, whether you choose to remain on dialysis after kidney failure or if you choose to go for a kidney transplant, this is a very, very personal choice. Please consult with your doctors before making such an important decision. And in terms of my final statements for the evening, again, this is your choice. You choose whether or not you want to remain on dialysis, go on dialysis, or get a kidney transplant. You also have the option of getting a kidney transplant, preemptive kidney transplant, before you go on dialysis. And if your doctor doesn't bring it up, you ask about it. Okay? All right. So that is our broadcast for this evening. I appreciate you taking time to listen to me. Thank you so much for watching. Next week, our guest is Kelly Hartman Messmer. She is a PKD patient. She is a brain aneurysm patient, and we're going to talk about brain aneurysms and PKD next week. And she's also a kidney advocate. So lots of interesting stuff going on. Again, I thank you for taking time out tonight to listen to an old man ramble on. And you have a good weekend. Happy Father's Day to all the dads out there. Thumbs up for dads. Way to go, dads. You're important to the family unit. You make a contribution to raising your children. And I wish all of you very, very well. I'm a dad. I have a son. God, he's almost 40 now. That makes me very old. And again, I thank you for watching. You have a good evening. Take care, my friends.